You're listening to American Medicine Today, presented by the Bonati Spine Institute, featuring internationally acclaimed inventor of the Bonati spine procedures, Alfred Bonati, MD. Once again, your host, Kimberly Bermel Bonati, and co-host Ethan Euchre and Jeff Wagstaff.
I have the greatest group of men that I work with and some women in the other room, but I'm referring to Ethan Euchre.
Oh.
Yes.
I'm not the woman in the other room.
She's segregating.
No.
Women in the other room.
And Jeff Wagstaff.
Segregating? Is that what you said?
No, you should only be privy to what happens
boy.
before we start the show. And Jeff Wagstaff and world-renowned orthopedic surgeon, Dr. Alfred Bonati.
Hi.
Hi.
Hello.
Now, a nationally renowned program to help reverse heart disease is now open in Pinellas County, Florida. And joining us right now is Dr. M.I. Yamani, Medical Director of the Ornish Reversal Program at All Care Health Center. Thanks for joining us, Dr. Yamani.
Thank you, and thank you for having me, giving me the chance to come and talk to you guys.
Absolutely. It's pretty interesting stuff, and it's
Yes.
all based upon this Dr. Ornish. Now, tell us about Dr. Ornish and how he developed the program and what it's all about.
Okay, so before, basically, Dr. Ornish, Dean Ornish himself started this thing approximately 35 years ago. So it's been a long time that he's been researching. And those were the good days when he was able to find those control cohort in his research who were not on the customary medications that we have our cardiac patient nowadays, right? Normally, everybody who has high blood pressure, diabetes, or high cholesterol and have chronic illnesses, they are pretty much on medications and all that. But he was able to have those control group of patients where he did some wonderful research, and he proved through his research that his programs, there are 4 elements that we'll discuss later, but due to those 4 elements, he actually showed actual reversal of the atherosclerosis in those patients.
That's fantastic.
Wow.
Yeah, that's amazing, and that kind of research is unique in a way that is very hard to reproduce that kind of cohort nowadays. So because he completely isolated those people without any medications and all that, and it started that 4 elements, and because of that, actually, by angiogram, it showed that their atherosclerosis has reversed, actually. So that's the unique thing about it, and that's how he started. I mean, his story is very unique. I mean, he was one of those geniuses that wasn't like fitting well. I think he was at Yale University and all that, and according to himself, I got the chance to meet him several times, and he's a wonderful man. So we went to San Francisco for experiential training, actually spent 1 week with him and his team there. So at that time, he described a wonderful story about himself, that he was kind of depressed with his routine things and about how the medicine is going and all that, and to the point of like suicidal tendency type of thing. But he was young, college boy and all that, and he found some guru, some teacher at that time who really lifted him up spiritually also, and then he started looking at other things that the routine conventional medicine is unable to offer, and that's how he continued to work with that. And obviously he's a research professor at the University of San Francisco, so he has his whole department of preventive medicine, and he wrote many books, actually. And
Well, let's get into what the actual program is, Dr. Yamani.
Yeah, because what we were reading, and one thing I wanted to say is in the write-up, it talks about how they address the root causes of heart disease versus just its symptoms, which I would assume is a big difference than what others do. And then the fact that it's not just diet and exercise, but it's basically group therapy.
Yeah, I found that totally different from anything I've seen.
So basically, let me give you a little background about the pathophysiology, or where the whole research is actually started from, or what are the consensus on this research. Normally speaking, at a primary care level, like which I am the primary care doctor, and at our level, at the end of the day, the whole idea of medicine is about giving a pill or a surgery, right? The whole industry, primary care industry, at the end of the day, what we can offer a patient, a particular patient, is a medicine, a pill, or refer him to the surgeon for any surgical intervention. But what the whole program is about, that we understand that every person is unique, and we all have a unique biochemistry and a nutrigenomic system in our body, which is unique to ourselves. Each individual is unique. So it's kind of a personalized medicine, you can say. And it is also about empowering each and every individual that we have a total control on our health. We are not dependent on a pill or on a procedure. We can actually control our own destiny, and that's how he started doing that. We have a choice that we want to stay healthy if we start the program or his teaching, early in our life, so we can stay healthy for a long time, or at any stage of our life, even what we call it as secondary prevention, after the event, after the heart event happened or stroke happened or somebody developed diabetes, we can start that program. So basically what he described, number one, empowering patients, empowering individuals, and making that believe that it is personalized medicine.
Doctor, why do you tell us how is the program, so we can understand it?
Exactly. I wanted to give a little background because the program is based on that understanding. So the program is basically that it's the way it has been approved by Medicare and evidence basis for those individuals who has known coronary artery disease, whether it is due to the symptoms of angina or chest pain or angiogram was done, but somebody who has evidence that have coronary artery disease, we enroll those individuals in the program, and then those individuals go through 9 weeks of programming. Each week, actually, there are 2 days when they come to the center, to our center, All Care Here, and they spend 4 hours at our office, at our health center. So we are doing nowadays Tuesdays and Thursdays. So twice a week, 4 hours each day. And during that 4 hours, they spend 1 hour with exercise physiologists and do different level of exercise according to their cardiac status. Number two, second hour will be with nutrition and dietitian. So we actually feed them. We have a cafe which prepare meals right at the spot, and then it is primarily a plant-based diet that they have to go through. We educate them what they're eating, and we feed them there. And then third hour is for stress management. We have different techniques of stress management is being supervised by an element expert that we have for that. And the fourth hour is for group support. So the whole cohort, the people sit around together and they discuss how they're feeling, and then the other person would, show their empathy, and they're more like a catharsis of their all the stresses and everything. So these 4 hours each day, the 2 days of the week they spend, and its program is approved for 9 weeks, so it's total of 72 hours. And once they successfully, quote-unquote, graduate from the program, then they become the alumni. So then they meet or they do their program once a month.
Dr. Mani, you began by telling us that there would be 4 elements that are reversed by the program. What are they?
So the first element is exercise. Okay. So one of the exercise different, and this exercise is according to the condition of a person, condition of a patient, cardiac stress. So that the element of exercise is governed by a person who is exercise physiologist. So they are certified exercise physiologists, and that different kind of cardiac movement, weight exercises are involved in that. So the 1 hour they would do this first element. The second element is nutrition, which is primarily choice of food, and not only that, is about mindfulness, how we choose our food. And as I said, each individual is different. So we a dietitian and a chef. We have a specialty chef. Those two guide each and every patient according to their body habitus and need.
Dr. Yamani, let me just interrupt because we're up against the clock, and I feel like we're kind of going over what you just said prior to this. So how long does it take for people to start seeing and feeling results? We got about a minute left.
So we, as quickly as like 7 to 10 days. It's amazing that some of these symptoms of chest pains and even arthritic symptoms, depressive symptoms start going away within 7 to 10 days, actually. It's amazing.
That's great.
So it's not that long haul or in the future you see improvement. You see right away improvement, actually.
Fantastic. And if people are interested, where can they learn more?
So allcareforyou.com,
Okay.
our site.
Yes.
And our number is here 727-545-4545.
Perfect.
45, yeah.
Thank you so much. Dr. M.I. Yamani, Medical Director of the Ornish Reversal Program at All Care Health Center. Thank you so much for being on the program.
Thanks, Doctor.
Thank you. Appreciate it.
Have a good
Take
one.
care.
Bye-bye.
Anything that can help stay off and reverse cardiac disease is good by me, especially
Absolutely.
in 7 to 10 days to start seeing a difference. Make sure you stay tuned because coming up after the break, Trump's triumphs. You're listening to American Medicine Today.